Hi, everyone. Thank you for joining us. I hope you're doing well. I'm very glad to be joined by some of the best people in the world who made time to speak on the webinar topic today. I'm going to give them a bit of time to introduce themselves very quickly, and then we'll have some housekeeping rules, and then we can get right into it. From my screen, I will start with Parth. Parth, would you like to introduce yourself first?
Thanks so much. Hi, everyone. My name is Parth. My pronouns are he, they. I'm a queer, non binary, mad disruptor from India. I'm a decolonial researcher, liberation therapist, and culture worker. I'm calling myself a baby abolitionist because that's where I'm going, hopefully, in the future. And reimagining abolitionist futures here with all of you. So, very excited to be here.
Thank you so much, Parth. I'm excited for you to be here. We'll move on to Sasha.
Hello, Grace. Hello, everyone. Thank you so much for being here. My name is Tasha Hajassaf. I'm a Lebanese lived experience expert and a human rights advocate. I am the co founder and president of the first and only Lebanese Lived Experience Association, which is Justice for Mental Health, and I have a legal background. I hope this conference will be fruitful for all of you.
Thank you so much, Sasha. We'll quickly move on to Lisha.
Hi everyone, I'm so glad to be here. I'm calling from Baltimore where it is 3:30 a.m. Thank you very much to the organizers, Grace, the Global Mental Health Action Network, and my fellow panel speakers for being here as well as to the audience for joining us today. So I'm the author of 3 books, including a memoir of schizophrenia at the University of Hawaii at Manoa. I'm a fifth-year PhD candidate in the English department. My research areas are life writing and mental health, with a regional focus on Singapore and Southeast Asia. As a lived experience researcher and advocate, I believe in the power of life writing to contest dominant narratives and amplify lesser heard voices. Very excited to be here today.
Thank you. And last but not the least, Matt.
Hi everyone, I'm Matt Jackman. I'm coming to you from the lands of the Gadigal people, the Eora Nation in Sydney at the moment, from Australia. I'm a mad activist. I'm a consultant, lived experience consultant with the World Health Organization around meaningful engagement of persons with lived experience. And I'm a current commissioner on the lived experience in mental health research in collaboration with Lancet Psychiatry, King's College, and Traumascapes. Thank you. Thanks, everyone.
Thanks, everyone. I realized I didn't even introduce myself, so I'll do that very quickly. My name is Grace Getera. I am a lived experience consultant and advocate from Kigali in Rwanda. If you hear some birds in the background, that's my gift to you. And yeah, I'm very excited and blessed to honor this. I'm very honored, sorry, to moderate this discussion. To quickly run through the format of this webinar, we will spend 30 very short minutes discussing some questions that we've come up with, but we're very keen for you all to send in your questions as well, as we'll have some time after this to answer some audience questions. I cannot promise that we'll get to them all in this session, but I'm hopeful that if we can, we will answer a considerable amount. But if not, we will continue. We will do something with your questions. We won't ignore them at all. I promise. There's please, as you ask your questions in the chat, do not forget to introduce yourself. But I can see everyone is doing it already. Thank you so much. Another thing to note is that this webinar is key to the strategic 2035 vision set by the Global Mental Health Action Network, the link for which will be shared in the chat. It is also part of the Global Public Health, which this year has the theme of redefining equity, which decolonizing public health, which is part of our discussion today. With that said, let's get into it. I got to be involved in the world of lived experience, which was really exciting to me in 2018. Before that, I was just a radio DJ working the graveyard shift. And all of a sudden, I was thrust into this world very happily, which was wonderful and incredible. I met fellow survivors. In fact, that's when I met Matt the first time. people with mental health challenges working to transform mental health from within. From my perspectives, at that time, it seemed all empowered, making change, speaking at conferences. It was thrilling for me because I'd never even shared my story with a single person, and all of a sudden, here was a group of empowered, dynamic people just working within mental health science. It was an entire ecosystem, and the way I got to know of it was through the world of, or the name, lived experience. The more I've delved into this world, the more I'm aware of how limited my perspective has been, and that I'm stepping on the shoulders of giants I know very little about. And I'm keen to change that and understand more about this. And with that, I come to the very first question, which is going to Matt and then to everyone else. Um, Tell me a little bit about how you came to be in this space and what name you preferred to address it as.
Yeah, thanks, Grace. And it's so lovely to hear your passion and enthusiasm all these years later. And I think in the decolonial space, it's almost like a process of constantly unlearning and having humility and being open to ideas and change. But yeah, I came to it through survival. I came to it through a lot of childhood abuse and neglect. I was in foster care, in institutional care, and lost a mother to suicide. You know, both my siblings and I have all been institutionalized. I've been hospitalized for more than a year of my life with various labels and psychiatric diagnoses, which I just understand as survival and responses to trauma and grief. So that's how I came to activism, mad activism, and I started in forensic mental health in the pointy end, where issues of violence and mental health were being, supported by the forensic mental health system. And I saw the co-option of a lot of our grassroots activism, lived experience activism in that space. And we call that the consumer movement in Australia. And I really sought for something more radical, more abolitionist, something that changed the structures and systems of how we even understand madness. And I use the term mad as a way to both reclaim that identity that's been used to oppress people like myself. And it's a way of also owning and honouring the wisdom, the gifts, the creativity, the spirit that comes with madness as well. Not to romanticize the psychic pain and distress, but I think it's really important that madness is viewed through many different cultural and spiritual frameworks. And yeah, that's how I understand and view my experiences. Thank you.
That's incredible. I've heard your story before, but it's always amazing to see how much, you've dedicated to this. Moving on, Path, do you have anything to share?
Absolutely. And I think I resonate with Matt on so many levels. I very new to the field of lived experience when we look at it as, again, branch of mental health, or we're looking at the more professional side of it. I entered this space again from my lived experience of incarceration, my experience of being misdiagnosed, coerced, and having structural, systemic, and interpersonal harm from a very young age. Although my um, worldview or my activism was branched out of queerness and from queer rights and trans rights, being a queer non-binary person, I viewed my lived experience to be intersectional, to be rooted in the positions that I occupy, being from the global south, being from India, being young, also being queer non-binary. And that's how I entered that space. The names that I would prefer, I'm also now understanding and being part of the mad movement, understanding like in queerness, in madness, it is rooted in resistance and liberation, and what that really means for me. So I'm very excited to be here and also share this space with everyone else.
Thank you so much. That's amazing. Sasha, do you have anything?
Yeah, first of all, I want to thank my colleagues for what they shared. It's honestly, this is what shapes us. And I want to say that what I truly appreciate about, mad activism movements and about the term that was basically reclaimed, historically, it has its weight, this term, is that we're really being honest. We're really being honest about, the dark chapter of psychiatry, which is something that's usually swept under the rug. Whenever we're talking about mental health awareness, we're really just focusing on the better so that nobody's scared. There's this entire approach, but there are so many survivors of this system, and it's just not fair when we just cancel this entire history. And basically, this era isn't over as much as we like to pretend that it is. The inhumane trial and error in institutions is not over globally. It's not just in a country or in another. And, all the different coercive, non consensual treatments are still taking place everywhere. So, yeah, that's what I wanted to share on this.
So I
And
want
what's
to,
the name you'd. Oh, sorry.
sorry.
Go ahead, Lishan.
Oh no, I just wanted to pick up on what Sasha was talking about, like in terms of history and the terms and expressions, mad activism and lived experience as well. So, just to add a little bit about the context of what is happening in Singapore, and to talk a little bit about conceptions of madness and how lived experience has changed over time. So, for example, when we look at history, the conceptions of madness in Singapore and Malaya were quite different, I think, from like conceptions of madness in the Western world. So, for example, the Malays they attributed a loss of semangat, which is the spirit or soul substance in madness, or there were also explanations of like angin or wind in the body. And just contrast this with, these explanations were kind of displaced by British colonizers' ideas of madness, described as maybe a loss of morality and lack of rationality. And so in this conversation, I just want to draw our attention to language and how during the colonial period, we were nameless lunatics, we were imbeciles, and subsequently known as the mentally ill, and then persons with mental issues. And then as of now, we have become seen as persons with lived experience. How the concept of lived experience in Singapore has been very important because it marks a departure of professionals thinking of us only in terms of diagnosis and treatment. So, and also a bit about tokenism, that while it remains a problem, in Singapore at least, we have now been included, I think, to some degree in committees, boards of mental health organizations, and senior management meetings as well, as a way to include our perspectives in decision making.
Yeah, till then, Sasha, do you want us to just add on a little bit of what Grace was talking about earlier as well? That, language is so important, and Lishan was also talking to us about being intentional. How would you view this community? What language do you draw your experiences out of? Sasha, do you want to take that on?
Excuse me, can
Yeah.
you please repeat the question? It was cutting. I wasn't sure
Yeah.
it was you were asking me. Yeah, tell me.
No worries. We were talking about the intentionality of language and also thinking of, how we are entering this space. What would you say is the language you prefer when talking about the larger movement of mad activism, people with lived experience, survivor movement?
Yeah, actually, thank you for this question. It's a discussion that we always have because it's a problem. And I think this is something that maybe we can tackle when we're talking about decolonialism because we have so many terms, Western terms, that we just don't know what to do with and that just do not seem relevant in our context. A term as, we often use service user, but it feels like it's empty from its meaning. Mad doesn't seem, we're at a place in Lebanon, for example. That's an interesting fact when we're talking about colonialism, and I'm referring to what Lishan was explaining. In our laws, we're still referred to, unfortunately, as lunatics, as crazy. These terms are still used, and basically our laws were taken from old French laws. So again, it's the trace of colonialism. And honestly, this point is something that we're still exploring because at the same time, we want to be aligned with international, lived experience movements, but we're still struggling to find, what's right, how we can cater to our own communities. So yeah, it's a bit challenging, and the terms in Arabic seem longer and heavier. So yeah, we're still trying to figure it out in this sense.
Absolutely. And I think it's so important to recognize that, we're still left with that colonial legacy. And I know for Lishan, for Singapore, for Lebanon, for even for India for that matter, and Australia as well, that we are all spaces where there is some facet of colonialism still present. So the way that we view the movement of Mad survivor activism, of people with lived experience service users, very interesting. From Matt, I'd want to know from you as well. Do you see any convergence in the current understanding of people with lived experience and with the Mad activism movement, and any disagreements that happen between these two larger, broader understandings of this work?
Oh goodness, absolutely. Yes, there's no. I think it's really important to note that this, what we call, at least in global North context, because I think often in global South context, the focus is very much on human rights. Oh, can you hear me? Yep, sorry. Yeah, so I think in global North context, the consumer survivor ex-patient inmate movement really evolved out of psychiatric systems, of course, which predominantly existed in Western contexts where psychiatry was much more prevalent, and that's something really important to note. Whereas often, in my experience in advocacy in global South context, the focus is really on psychosocial disability and fundamental human rights. So there's definitely a lot of converging discourses, that are much more reformist. Some are more radical. I think the MAD movement and the use of the term MAD has come in part thanks to the MAD pride, but MAD isn't synonymous with having a MAD pride perspective. It's really about bringing in a decolonial perspective, actually, and embracing global North and South contexts where maybe the concept of psychiatry doesn't exist to the same extent. But we can still understand and name the discrimination that occurs for people experiencing madness in global South contexts where institutions or psychiatry might not exist. So that's where MAD and the development of MAD studies has come from, which is sort of the theoretical and philosophical discipline grounding a lot of this MAD activism at the moment, is really opening and expanding beyond a very white global North, high income centric psych survivor background. Where that's just not the case for everyone around the world. So, yeah, there's a lot of contentions, a lot of differing frameworks, and there's no universal one way to understand the movement. I think that to me is my understanding.
Thank you. Were we talking about the convergence with modern lived experience? Sorry, an occupational hazard here in Rwanda is that my internet goes off. My apologies. But I would be interested in what you think about the convergence of the movement you talked about, Lishan, and current or the modern lived experience work. I know you spoke a little bit about it, but I'd love to hear a little bit more.
Yeah, so I think mad activism in the Singapore context, in a way, has been quite different from the Anglo-American sort of CSX and survivor movements. And I'll just describe one such difference. Like I think in Singapore, um, there has been less of a pressing need to reclaim mad activism due to the issue of co-optation, because for us, it's not so much co-optation or tokenism even, but assimilation. So what does assimilation mean? It means to become absorbed into a culture. So what it is, in a way, is that, as I see it, persons diagnosed with mental illness have become absorbed into this predominantly biomedical framework and language. And we're mostly happy, actually, to work with professionals, families, policymakers, community-based partners, and in a way, it's quite different in terms of the history of how peers have been working in Singapore. But assimilation is also, supported by broader societal trends where the language of mental health, for example, talk about mental resilience or stress management, has permeated everyday conversations. So in Singapore society, we actually speak quite fluently in terms of the public in the languages of mental health and healthcare. But and this has created a society where recovery is paramount, and where but also where mental distress is conceived in terms of illness and where deviance in thought is cast in biomedical terminology, which in a way promotes conformity and discourages creativity. So it seems to me that to reclaim our identities, we need to actively question the mental health care landscape and reinterpret mental health in terms of the political, which is particularly important in a depoliticized environment where, for example, a political protest would be quite mystifying to the public, and where human rights is in a way downplayed, so less of a priority.
Path, do you agree?
Absolutely. And I think it's so important for us to also recognize the relentless sanitization of mental health landscape and the current disservice user landscape of what, even Sasha was talking about, how that sounds very hollow. It's because we're reducing years, if not centuries, of dehumanization, of coercion, of colonial legacy to a consumer model of someone is receiving a service versus someone is providing it, completely detached from the politics of it all. Coming from South Asia, coming from India, coming from the larger landscape where we are currently. I mean, look at what's going on with the genocide in Gaza. Look at what's happening to the people in Congo. Look at what's happening to the people across the world, to all oppressed people, to indigenous people in the Americas as well. We're looking at the effects of colonization in real time. Yet we are not adding that to the context of the larger public health framework or global health framework because it doesn't fit into the neatly sanitized language that people would prefer. So therefore, it's very apolitical, and that's something that I've always found very disturbing and also distressing. Because as Lishan was talking about assimilation, there is also co-optation that happens here in South Asia of language because we've retained exactly the same public health models of the colonial era. We still have mental health language. We're still being taught the same mental health curriculum with one small certificate course on what does it mean to be South Asian, what does it mean to have Asian healing techniques, in which we further, fetishize and also commodify the whole of Asia into China and India and say that that's about it. You get a footnote on a course curriculum once in a while and then go to the social justice aspect of diversity, inclusion. But that is not what we're talking about in activism or decolonization. That's far from the truth. Decolonization inherently is rooted in resistance and the politics of resistance. It's inherently a very violent space. And when Ishan was talking about youth protests, also, I was thinking about right now, look at the pathologization of people who are protesting for Palestine across the world right now, right? They're being called mad. Look at the people who are standing up for their rights, whether in Iran, women are being called mad and incarcerated into spaces, both psychiatric and non-psychiatric, for wanting human rights for themselves or for resisting the gender apartheid. So this is the same playbook that we've all seen happen in our own countries, right? The relentless sanitization and co-optation, assimilation of a movement to ensure that the voices are not represented because it fits in the status quo. And that's something that we're all actively in our work resisting in some way or the other.
This is incredible. But we do have to move on to our next question. And this, I would like, it's actually within the same context. And I'm sorry to come back to you very quickly, Lishan. I am very interested in what comes to your mind first when you hear about the call to decolonize public health, and in this case, mental health.
Thanks, Grace. So I have actually quite a lot to say about decolonization, but I'll make maybe 2 points. So first, I think decolonizing global mental health necessitates location-specific inquiry. For example, I would focus on here. I would focus on the post-colonial period, which was post-World War II, such as the 1960s in newly independent Singapore. So when we think, unlike during the colonial period, where the insane were often reported as cases of amok or lata, in the 60s, there were coexisting modalities present. So at the psychiatric hospital itself, we found exorcists, Chinese tankies, spiritual healers of all faiths. They were largely tolerated at the hospital. So they were actually given a space in the garden. They were given private rooms to conduct their healing rituals. But yet, as Singapore became further modernized, this practice and tolerance disappeared. So I'm wondering, whether this can be brought back. And secondly, for me, decolonizing mental health means attending to the connections between coloniality and psychiatry, especially issues of power dynamics. and the objectification and the classification of the colonized patient in mental health practices. But Singapore, as mentioned, is a society that is largely depoliticized. So this means that persons diagnosed with mental illness have not been encouraged to galvanize their resources and capabilities to contest, question, or struggle against the mental health establishment. And empowerment has, in fact, disguised a kind of disempowerment that has taken place. So the post-colonial state and mental health establishment have taken a stance of top-down empowerment to create what has been called the peer movement. It utilizes the language of social movements, using terms such as recovery, coalition, and collective, without involving the work and the power of a genuine social movement. So in a way, it might be called a poison gift.
Thank you so much. Sasha, what do you think?
Please. First of all, this is a topic that honestly needs a month of non-stop talking, but we'll have to squeeze it real quick. So that's what I'm gonna do. So in my mind, when we talk about decolonization, we first need to talk about colonialism. And to me, there are three essential elements. First one, asymmetry of power. Second of all, the need to dominate, conquer, and impose certain ways that are better. And then third is the notion of others. The others are threatening us, and the others are usually the non-conforming, those that do not necessarily serve the colonial goals and the colonial, structure. And here, when we want to think about decolonizing global mental health, we have three levels to look at. First level, as my colleagues were mentioning, is the level of knowledge and practices. And basically, for example, if I want to give the example of Lebanon, the first institutions established in Lebanon, and we still have one of them, were really the result of colonial expansion, the British and the French. The curriculum, practices, knowledge, everything literally is a replica of Western ones. And at the same time, it's all tailored by people that live so far away, look nothing like us, and live a completely different life than us. And basically here, like, it's the need to conquer knowledge as well, the need to really dominate mental health, which is an area that cannot be dominated. A few classifications cannot really summarize the entire human experience of distress. And then the second level that we have that's very important, it's decolonizing the mental health system from within. And here it's the dominance of the professionals. And of course, this is also taken from the Western model of the psychiatric biomedical Western model. And basically, it's again this need to conquer. I don't know, like, I imagine an event where we have psychiatrists, psychologists, they're cutting a big cake, and yes, like, we conquered mental health. It's really like this for us, at least. And it's honestly the exact opposite. We cannot. I really hold on to this slogan, nothing about us without us. Please don't come and use terms that we created without incorporating us. I'm really, like, so tired of tokenism. We have beautiful strategies, gorgeous programs that are so donor appealing, but at the same time, they're so empty from their sense. And what really reinforces this system is that in Lebanon, NGOs are basically, dominating the mental health sector. And when we have this system, basically, we really rely on Western donors and their agendas. And third, and the last level, is the political dominance of the West. As much as we like to portray mental health as a cute, soft topic that's, very individual, very clinical, that's not the case. This is not true. Mental health is so political in every single way, from start to end, if we want to look at the determinants, and then we want to look at the influence and how it's run. And basically, like, this expansion of the psychiatric system that we have is just misfitting. When we think of mental health, we really need to consider context. And what was screaming during this year, I really understood this in a better manner, because this is not the past, this is the present. It's basically the war that we had in Lebanon. The same governments, Western governments, that came to interfere in our internal affairs, were the same governments funding our mental health programs, and were the same governments that were funding and providing ammunition and weapons for IDF to bomb us and do genocide in Gaza. And needless to say, this is horrible for our mental health. So that's it.
Is everyone else enjoying this as much as I am? I am really enjoying this. Thank you, Lishan and Sasha. Matt, very quickly, what are your thoughts?
Yes, well, our existence is deeply political, isn't it? You know, our livelihoods are deeply political, and it's really important that we return to context and we return to those structural determinants. Very quickly, I think, yeah, we need to obviously challenge those Western Eurocentric understandings and knowledges around the biomedical framework, the medical dominance that exists in mental health. That requires critiquing and the pathologization of distress or psychic pain, which often dismisses and erases those social, spiritual, historical, and cultural contexts. Many Indigenous and global South perspectives often view distress through relational or collective or spiritual frameworks, and that's certainly the case to some degree for Indigenous communities in Australia as well. And that's by centering community knowledge, oral traditions, and holistic healing practices. We've Sasha touched really well on it, Path as well. Addressing structural violence and historical trauma. Issues of obviously forced displacement. Other intersections of racial oppression, of capitalism, of misogyny and sexism. There's just so many intersections of oppression that exist, and to me, mental health is symptomatic of a problematic world. More globally. And the third is just around being able to reclaim stories and narratives and promoting epistemic and justice. And that just means knowledge justice. We exist in hierarchies of knowledge. And if we understand that within the psychiatric model, we understand that psychiatry has all the power. My dad often said, if you want something done, Matt, when you're in hospital, go straight to the psychiatrist. So we really, that is applied to all aspects of race and whiteness, of gender, and I could go on, but it's really about reclaiming the right to define, name, and narrate experiences of distress in people's own language, their own cosmology, and meaning-making systems. So that's it for me.
This is incredible. I'm going to move very quickly to Parth because we have a couple of more questions. But Parth, I'm really keen to hear what you say.
Absolutely. And I think I'm going to take a slightly different stance than my comrades here on the call and say that you can't decolonize a colonial system. That's like saying you need to be chaperoned by your oppressor and you need to be chaperoned into rooms as the oppressed, neatly packaged into a nice little box with a bow on yourself to be presented to people. That when you say you want to decolonize a colonial system, you're essentially saying that the colonial system what needs to happen? Does the colonial system need to dismantle? Then are we working towards dismantling the colonial system, or are we introducing more diversity into the colonial system itself? A cop is a cop to me in my language, whether the cop is brutalizing kids, brutalizing black people in America on the street through police violence, whether it is cops colonizing Kashmir today in India, whether that's cops brutalizing people in the therapy session wearing a cardigan in the form of a psychiatrist or a therapist. So, to me, in my head, are we decolonizing the colonial system by simply introducing diversity through social justice? Or are we actually dismantling colonial systems of oppression that inhabit all our structural systems and all our lives? That includes our education, that includes the way that we view language. The fact that we're all here talking in a language that was used to colonize at least my people for such a long period of time. What does reclamation feel like to me as a culture worker when I'm still talking to you about revolution, abolition, and resistance in the colonizer's language, right? How much can we adapt? How much are we then being assimilated? So when I'm talking about decolonization, I would also want to throw that back to the people here in the comrades here and also the people tuning in. Are we really wanting to decolonize, or are we really wanting to strengthen indigenous methods of healing, indigenous sovereignty? Decolonization, by the name of decolonization, is regaining sovereignty over land, people, cultures, and regaining autonomy. How do we as people from the mat community, how do we as people holding intersectional identities regain that sovereignty? So that's a question I'm going to throw back. Do we really want decolonization, or do we want indigenization of our systems? Do we really want to dismantle colonial oppression, or do we want to come up, press to the status quo and say, yeah, we'll want some proximity to the power and make some change through diversity there? So could be rather provocative statements, but I hope they, also make people think about it a little bit.
I have been non-stop smiling throughout this webinar, and I don't think that's going to stop. Coming back to you, Path. Um, like you said, indigenization of systems. And for me, when I think of lived experience, based on how I came into this, I think of community. But this may not reflect how it is as it right now. So, what are some practical steps you can suggest to achieve that? And I'll come back to the rest of the panel as well.
Absolutely. And I think it's so important for us to understand what and who constitutes community. We love in the post CRPD era of the institutionalization to talk about community mental health and, completely move towards community leadership, co-ownership, co-design. We're introducing less oppressive forms of research from what used to be very oppressive forms of research by introducing this language. But then we don't want to talk about what really qualifies as community, who is part of that space, and can you really put boundaries on what a community looks like? So then that becomes really important. Where do you draw your lived experience from? In India, I know that for a fact, in South Asia as well, we don't hold single identities as such. So there's no one person with just a psychosocial disability who would say, I'm a service user, or a person with lived experience. They know that they're holding a caste position, which also determines their place in the social hierarchy of India as such, and where and who they can form as community, right? So all people with lived experience, all people who was a part of the MAD movement are not all people holding the same intersectional identities. So it becomes extremely important for us to, again, do context-specific inquiry. I'm taking from what Lishan said earlier, and understand where do we belong and what are these spaces that we occupy. I know for a fact when I do when I do a positionality statement right here in front of you, I know that I'm a light-skinned, highly educated, upper-class person from India who also has multiple disabilities, who also has chronic illnesses, who's talking to you about mad activism. I'm not sharing any of those social occasions with someone who comes from an oppressed caste, comes from a minority religion in India, who's dark-skinned, who was traditionally or has been oppressed because of being fat. So there are different identity markers of who qualifies as community and what that community means to you. So I would say one of the steps would be to do that inquiry first and identify where do you belong? What are the spaces that you're occupying? And then to relate to people where you are and say, am I okay with dismantling my own power systems? Am I okay stepping down from those powers? And at the same time, centering the people's voices who are not in the room present with us right now, right? I'm also questioning when I think of all of us here. All of us know each other's work. Was this the best representation of the entire mad survivor movement as well on this call itself? We know a lot of people working in grassroots in our own regions, in Singapore, in Lebanon, in Australia, in Rwanda, in India. What would it mean to have them represented right here? So when we say actions to decolonization, it actually starts with that inquiry of positionality and power, which goes back to what Sasha was also talking about. How do we view power and how we dismantle power becomes very important in this context.
That's great food for thought. Lishan, do you think that's even a question you should be asking?
Oh, absolutely. Yeah, so privilege, I think also of when Parth was speaking of, which I think is very important, I think of privilege, I think of how I am a privileged Chinese Singaporean in a predominantly Chinese society. I think of how, minority races have been treated with epistemic injustice in Singapore. I think of stories that I've been told where persons have uh, where their words and actions have been kind of pathologized. So yeah, I think what Pav is saying about privilege is really important to recognize and acknowledge. I actually also just want to make a comment about what Pav was talking about just now about decolonizing mental health and about cultural sensitivity and things like that. Because I also feel that that I mean that there are quite a lot of like mental health practitioners, eager to jump on a decolonial bandwagon, using the term liberally without like thinking harder about what it might mean for us in our specific location and context. Thinking of it in terms of cultural sensitivity, modifying and adapting practices from Western psychiatry, as though like a superficial translation of language and cultural context is enough to decolonize our deeply rooted colonial mindsets. So, and then this question about like replacing uh, the current psychiatric practices with traditional practices from the past is also not exactly the answer, even though these practices certainly ought to be given more room to be utilized and practiced today. I mean, I certainly believe that there's great value in preserving such practices so that we don't lose our identities. And it begins with a recognition that the Western biomedical model is just one node in a network of nodes, right? Sitting alongside other equally legitimate ways of being and thinking. But beyond the preservation of traditional practices, I do think that a decolonial approach is strengthened through our being informed by histories in mental health and teasing out colonial legacies, which isn't easy work, right? So we have to revisit and reinterpret our current accounts of history actually from lived experience perspectives. So finding our own concepts from linguistic and cultural heritage, speaking about these concepts and modalities with confidence as we allow ourselves to be ourselves, as opposed to being shadows of our past colonizers. But also to return to this question about community, right? Like just wanted to say that, that in relation to community, one goal of mental health advocacy can be to actually bring social and political analysis into these overly medicalized discussions on mental health. But this transformation of the sector, I feel, is actually made by persons with lived experience, working together with mental health professionals, researchers, and others. Because it's very easy, in our enthusiasm to be independent, to understand the relationship between professionals and peers in terms of us versus them. But they're actually quite progressive and even radical mental professionals who are working within the system for change. And the actions of these professionals have led to the greater involvement of persons with psychiatric histories in the mental health care sector. And also to note that the majority of mental health professionals are very well intentioned. Good intentions are not always sufficient because there can be unintended consequences of well-meaning mental health policies and treatments, which can be very damaging and harmful to the people they are meant to help. Um, but but this easy sort of us versus them kind of thinking, we can do better.
I think so as well. Very quickly, Matt, how can we build community under lived experience?
Yeah, I think everyone's spoken so eloquently about, the challenges of community. I think, as Path mentioned, I think it really starts with, doing some deep diving into ourselves and our positionality, our identity, the power that we have. I'm often thinking about that of spaces that I'm in, spaces that I've come from. Many of us here on this call have a lot of power and privilege in the activism spaces that we're in as well. And we often have to think, am I the right person to be am I the right person to be in this webinar, or am I the right person to be this consultant? And that does require a lot of critical reflection and doing action from that, being reflexive about that. But I think to me there's no one answer or truth. I think that and I think mad methods kind of speak to that as well. I think that there's a lot of there's a lot of truths to what we're all saying. And I think that the reformist versus abolitionist or radical transformative perspectives kind of mirror the movement itself. It's sort of, do you want to build community from within the system? Because we, in many ways, still need reform. People need care and support right now. I have siblings that are incarcerated in and out of prison, forensics facilities. So I know through that lens the very real realities of people living with distress and madness. And you have to remind yourself that you have to sometimes be pragmatic and work within the system that you are within, and also aim for that process of utopia and liberation. I think that they can both coexist, and I think abolition is a process. I think it can be worked toward. I don't think it's an end. But I think we can hold space for existing within problematic, broken, unjust systems and doing what we can as human beings and validating who we are as well, rather than selling ourselves out. But also, being mindful of the positionality and power that we have, and knowing when to step back and take space, and make space. Yeah, that's what I'd say to community.
Thank you so much. Sasha, while you hold on to this, I'd like to ask you our last question, and you can sort of answer them together because they're sort of similar. The question is, as we clearly see, lived experience and the mental health field are evolving. Like we spoke about previously, what, in your perspective, and using the learning of those who broke barriers before us, the people who came, the disability rights activists, the people who pioneered the mad rights movement, what do you think is an ideal future for mental health and lived experience activism and advocacy? You're very, please ask if you need me to repeat this question because it's a mouthful.
I'm fine, don't worry. So, yeah, basically, before I start with anything, I like to stress on the idea again and again that context, context, and context. That's the first thing. And maybe this should be the direction for my answer regarding the two questions. First of all, also, we need to understand that each context is at a different level. As we are speaking right now, we have people that are literally in human cages in institutions and asylums and in secluded rooms, or that not are not allowed to eat as a form of punishment, or so. That's the first thing that we need to understand. There is not one level of mental health in the entire world. The rights are very different from one place to another. Perception systems, structures are super different from one place to another. Second, in order for us to really look at, breaking these barriers that we have, dismantling the power structures, as my colleagues were speaking, we really need to, again, look at our context, to assess, to understand, to see our attitudes and look at ourselves and really understand the impact of colonialism that, we hold inside. Because, as much as we think of colonialism sometimes as something that's external, sometimes we hold on to it in our attitudes. Sometimes the community that we live in hold on to it. And as it was mentioned by one of my colleagues, that of course a lot of practices that were introduced were very bad and distressing for us as a group. Some were good, some were better. It's really a homework that each of us should be working on. I invite national strategists, people in high rankings, leadership to really be working at this level. Really creating a strategy that fits your context. We cannot copy paste when it comes to mental health. It doesn't work like that, because as much as we like again to pretend that it's a floating topic. That comes to us, it's not, and it's very political and it's very social and it's interlinked with so many other factors. To me, like, we really need to also identify the power structures that we have and who's in charge of what. So in these days, at least in Lebanon, we no longer have territorial colonialism, and it becomes a bit confusing for us. What's that? Are we like conspiracy theorists? I'm going to talk about the global at the global level. I'm just going to give you one tiny example for you to understand who's in power and how all of this started. I want to remind you that homosexuality and the slave running away from their owner used to be a mental illness. I want to remind you that basically classifications are based on capitalist goals that are related to the economy and how productive a person can be. We don't have time to go through all of this. But then, like, let's look really again at our own context and see how did all of this impact what we have. How did all of this impact people within our community? And this is something to really think of. There is no one way for me to just say it right now. Basically, we need to understand our role, what we can do. And I really want us all to defy the idea of being diplomatic, because sometimes we're invited to be diplomatic, especially in difficult contexts. For example, in Lebanon, we're just jumping from one crisis to another. We had a huge blast a couple of years ago. We still didn't recover. We have an economic collapse. We have a war. We had a pandemic. Like right now, we're still getting bombed in the south. So it's very hard for individuals to really have one priority, like we want to dismantle power structures and mental health and focus on it. We're so distracted and we're so tired, honestly. And we also are sort of hopeless, especially that we have a lot of clientelism and very rigid power structures. And when we're in this context, we often feel like there's nothing that we can do more than being diplomatic and, sitting on the table with others and, trying to make our demand smaller, our size smaller. But honestly, this only ends up, like from my own lived experience, this only ends up making you suffer and not go anywhere. You give so much for very little, and you never really get your rights. And I would say that we should really work and advocate when it comes to donors, the funders, the external, funders that are trying to change a bit this scenario, that are trying to work on, changing this colonial scenario that we have, on really building something new, as Parth was mentioning, rather than just, building over all of this history that we've been talking about. It's really about us reclaiming mental health practices. And finally, I want to say we really need to understand at the local level to let go of this idea, this adoration of evidence based research that was produced in the X and Y institution. And we really need to start relying on our own knowledge production, our own resources, especially lived experience communities. So that's it.
Thank you so much. That was a really insightful answer. Matt, as a bit of a pioneer yourself, what do you think of this question? Is there an ideal future for mental health and lived experience activism?
Absolutely not a pioneer. Do not put that label on me. I come after many, many amazing, incredible leaders and many movements, as everyone has mentioned in different contexts. So, but I think we, as a society, need to be able to name the ism, the systematic discrimination and oppression that Mad people experience. In some global North contexts, there's terms like saneism or mentalism. We need to be able to name it like we do, racism and sexism, and we need to be able to call out people, calling people an idiot or an imbecile or borderline or crazy or insane. When do you ever hear people calling that out? And that happens all the time at an interpersonal level. And at a structural level, of course, people are discriminated all the time with employment, with housing, with access to all sorts of things. So I think it starts there. Where systems do exist of psychiatry, I think we need to be able to name that as oppression and name coercion as oppression, so that we can start acting and doing something about it. I think the big root cause issue, which Sasha mentioned before, is knowledge production and epistemic injustice of knowledge, and how some knowledge is privileged over others, and that as a society we have to grapple with that around how we embrace and make space for all knowledges and pay equitable attention to different explanatory frameworks of madness, of care, and of course addressing the injustices of the world. I think in terms of moving forward, it's about, for me, cross-solidarity movement building with other causes that address human rights and social justice issues. So we are not alone, and as we've heard about from other speakers, madness intersects with almost every other rights and justice cause. So, we're mad in a mad world, as the saying goes. That's it from me. Thank you.
We're mad in a mad world is a quotable. Path, what do you think?
I think, when I'm thinking about ideals and abolition, I'm reminded of that quote by Arundhati Roy that another world is not only possible, she's on her way. On a quiet day, I can hear her breathing. That we don't need to think of abolition as something which is far fetched, it's happening. A new world is possible and it's coming very quietly. When I think of what the movement of lived experience can look like, I am going to call out something which I've been noticing over the past couple of years is that rise of professionalism, diplomacy, and sanitization of mental health. I hope moving forward, those things end. Here again, I want to go back to the words of Edward Said, and I say that being more important now than ever before. That the particular threat to the intellectual today, whether in the Western or the non-Western world, is not the academy, not the suburbs, not the appalling commercialization of journalism and publishing hosts, but the attitude which is professionalism. And by professionalism, it is thinking of your work as an intellectual, as something you do for a living. Between the hours of 9 to 5, with one eye on the clock and another at what is considered to be proper professional behavior, which is not rocking the boat, not straying outside the accepted paradigms or limits, and making yourself marketable and above all presentable. Therefore, you become uncontroversial, unpolitical, and objective. I hope moving forward, we can leave away this idea of professionalism to becoming messy, go back to the community, get your hands dirty with the work, join grassroots movements, work with community organizers who've been in this space at an intersectional level for decades, if not more, and work within those communities as well, right? And see what does lived experience mean outside this ally industrial complex. What does lived experience mean truly in the hands of the people that are navigating the structural, systemic, and interpersonal oppression on a day-to-day basis. So the future for mental health and lived experience, I hope, is by the people who are actively reimagining abolitionist futures and are creating that system for themselves.
Thank you so much. Lishan, last but not least, what are your thoughts?
I think I'll just very quickly say something which, Grace, you mentioned those who broke the barriers before us, and I just want to draw attention to the predecessors, my predecessors from colonial Singapore, from colonial Malaya, the asylum inmates who utilized what might be called the weapons of the weak, because the public order and stability was so important to the business of the British colonial masters, and given the Enlightenment ideals of rationality and men having the power to tame even the forces of nature, these unpredictable individuals had to be controlled and dealt with. So one way of managing such public disorder was through the incarceration, diagnosis, treatment, categorization, and the study of persons thought to be mad. And our predecessors seemed to be powerless, and yet they showed their agency. They refused to cooperate with programs of occupational therapy. They attempted to escape the asylum by climbing over the outer wall. It was covered at the top with the glass shards, and they also attempted suicide. And these were actions of agency. And I think when we think about mad activism, normally we think of something like maybe in Singapore like 2000s onwards, but actually I want to say that we can think further back in the past. When we think about the future of mental health, we also need to think about the past and the history that has already happened.
I completely agree, and yeah, this has been amazing. I've had a lot to think about. I thought I was honored before, but this generous outpouring of knowledge and input has been so incredible. Unfortunately, because this is my first time moderating, I did not do well with time, so we have run out of time for audience questions. But um, there's I've been promised that there's going to be a circle on this on the GMH AN's online circle platform. So please head there. There'll be an open space to have conversations and to continue this going on. But right before we close, I'd like for members of our panel, starting with myself, I guess, to finish this sentence. For a decolonized mental health future, our members can, our GMH and members can, sorry, the Action Network. Um, and starting with myself, I think for a decolonized mental health future, I think we should just go back to what all my colleagues have said. Think about our positionality, think about our privilege, and think about how we can use that to build on. Um, and I'll quickly go to Sasha, and then Path, and then Lishan, and then Matt.
Okay, I'll make it very quick because we cheated a lot with time. I have, I'm gonna go over them like bullet points. First of all, facilitate knowledge exchange. Second, challenge the imposed methods that we're used to. Third, focus on knowledge production. Fourth, share fundraising strategies in order to dismantle a bit the power of external donors. Support lived experience initiatives and put them not just at the center, like in an operation room, but leading. Push for more equality between lived experience movements, between different countries. without having one form. And finally, raise awareness on the dark history of psychiatry. Done.
Fantastic, Sasha. I think for a decolonized global mental health future, the Action Network members can use your platforms to speak up against the genocide happening in Gaza right now, connect to what the colonial legacy is in your own country, and go towards cross movement solidarity.
So our Action Network members can resist official narratives and speak our truths as acts of citizenship to connect with others, belong to community, and find our place in the world. It's not mental health that we should care about, but human beings and mental health.
Oh, is that me? Yeah, I ditto to everyone. Yeah, the Action Network members, I think, can name human rights violations and the oppressions we've been talking about, and the intersections with other issues that are have cross solidarity movements. Be able to speak openly about madness, and work as a society towards accepting it, and dare I say, even celebrating it, and centre equitable power symmetries, being aware of your own power, and just taking action, whether that's small or big. I think it's so important that we don't just speak, we take action in our local contexts, and we're better for it when we're taking action and we're working together.
Thank you, everyone. This has been incredible. And goodbye, everyone.
Thank you so much, everyone.
Take care. Thanks, everyone.
Thank you.
Take
Bye-bye.
care.